Hi everyone, it's really nice to see everyone here. We have a special global VMR. It's a bit early, so I really want to thank everybody for joining. This is going to be a special morning VMR because we have a very special guest. She's going to introduce herself in a bit, and she's very passionate about rural medicine. In these sessions, we try to teach everyone and learn a little bit more about how our colleagues around the rest of the world practice medicine. We usually focus on hospital medicine and medicine with all types of resources, but we have forgotten a little bit about what happens in rural areas with very few resources all around the world. Marcia and I are very passionate about rural medicine. We both work at rural clinics, and we thought that it was going to be a very interesting meeting, learning about experts in the field, about how they work with their patients and all sort of difficulties that they face on an everyday basis. So me and Deborah are going to be moderating the session, and Marcia and Veronika are going to be presenting the case. Deborah, do you want to go ahead and introduce yourself next?
Hi everyone, I'm Deborah. I'm part of the team. I'm from Brazil and med student, but now I live in Argentina. Excited to be here, and yeah, we are happy to have our guests here. Thank you for being with us. Marcela, do you want to introduce yourself?
All right, thank you, Deborah. Hi everyone, my name is Marcela. I am a Secret Silver's team member, but also a Rural Seeds team member. And I'm really happy to be here today to talk about rural seeds and about clinical reasoning in rural areas. So now, Veronika, can you please introduce yourself?
Hi everyone, I'm Veronika Rasic. I am currently a GP working in the UK, but I trained in medicine in Croatia and worked there for about 5 years before moving. And I'm one of the founding Rural Seeds ambassadors, and I'm really happy that we'll have a chance to talk about that later on. I don't know if you wanted me to say anything else or whether you wanted me to just move on to the case that we prepared for today.
Thank you, Veronika. It's really an honor to have you here. And I know that we're gonna have a Q&A at the end so that we can talk with Marcia and Veronika more about rural health. But before we start, I was wondering if you want to give an elevator's pitch of Rural Seeds. I'm very familiar with the organization, but I think the rest of the participants might not know about it. So I think this is a great moment for us to set the scene of what we're going to be talking about.
Okay, so Rural Seeds came together in 2017. It is under a bigger organization which is called WONCA, which is the World Organization of Family Doctors, and with the support of Rural WONCA, which is the Rural Working Party within WONCA. And the aim of the group initially was to raise awareness about rural health, rural medicine, rural careers among students and young healthcare professionals. It initially started out with aiming mainly at medical students and doctors, but thinking about rural medicine, we decided to expand that and include all healthcare workers in rural areas, because in rural areas you very much need to work as a team, and many areas do not actually have a doctor practicing there. So it's a global network that brings together people with an interest in rural health, and we participate in advocacy, we participate in raising the profile of rural medicine, we are organized around projects, so we very much want to be doing things to try and change what's happening in rural areas. So we have first the Rural Cafe, which started prior to us starting Rural Seeds, so that's been ongoing since 2015. And the Rural Cafe was a place to just come together online with different people from different places and talk about their experiences in rural medicine. And following that, we also then started a mentor-mentee project where we brought together experienced rural doctors, students and young doctors, and tried to help them develop their career in rural health. And we have video projects, we have Rural Success Stories, which is a blog where people can contribute their kind of story about their rural health experience. And currently we're working also on developing an education program with Scholar RX, which is an online education system. And so we're kind of in the beginning stages of developing a module about what is rural health. So yeah, that's kind of a bit of an overview of who we are and what we've been doing.
I love it. Thank you so much for sharing. And Marcela is going to be sharing some resources about rural seeds through the chat. So please check it out. I know that everybody here comes from a different part of the world, but rural health is present everywhere. And I know that a lot of people get to do rural work, especially, for example, in Latin America, where a lot of students serve that gap. And so check that out. It's an incredible resource. And now we're going to be moving on to the case. Veronika, if you want to give us a little piece of information, go ahead.
Yes, so I'd like you to think about this in a bit of a different way. So I've set this case up from the perspective of a young doctor that's recently moved to a new rural area, minimally prepared, not knowing really what to expect. So this was a kind of case that came up during my first few months of working. And I'd recently moved to this rural village, and they've not had a family doctor for more than 5 months because of doctor shortages. So the patient that we're talking about is a 68-year-old lady who's visiting you with her husband, who's 73. And the husband is very quiet, and he's speaking with a hoarse voice and not really saying very much. But the woman is complaining of worsening lower back pain, and it's been affecting her walking and making it very difficult for her to sleep. So that's kind of the opening of this consultation.
Ooh, awesome. Thank you so much, Veronika, especially because you've set the scene so importantly. It's really important to have the scene, just like when you're reading a book, it sets you somewhere. In medicine, you really need that background story. So I loved how you started it as a story. And we have a 60-year-old female complaining about worsening lower back pain. And back pain, I think, is one of those chief concerns we see a lot, especially in primary care clinics. Does maybe some people in the chat want to tell us a little bit more about how they manage back pain, especially what are those red flags that you tend to look for when you're looking at back pain? And we'll give a minute to see who wants to volunteer to discuss a little bit more about that.
I can say a few words. I think recently we have a case that Reza was discussing with Robbie about back pain, that it's normally one of the most chief complaints that people show up, and like normally, usually it's self-limiting, and then we can look for some red flags like fever, if there is a high WBC, if there is a focal neurological deficit, if like there's B symptoms, if it's a trauma, if like there's some urinary symptoms. So I think that could be my first thought.
Thank you so much, Deborah. I love that overview of red flags. And when I work when I work with my students at the rural clinic, I tell them about two tenets in primary care. First of all, you need to focus on red flags because there's a lot of things that we won't be able to work up as much. So for example, even doing a white blood cell count or imaging, those are next tier. So if something doesn't work up a red flag for you, you really need to be okay with some uncertainty. And being okay with that uncertainty comes from knowing your red flags, and whatever is a red flag should be worked up more. Whatever is not a red flag, we can deal with maybe in a more non-pharmaceutical way. per se. And the second tenet I tell them at the primary care clinic is we can't really work on a lot of chief concerns at the same time. So you really need to prioritize. So I love looking at this through the film of flags to see if we were going to be able to work it up a little bit more. And I know that Vale spot a red flag on this case. Vale, do you want to tell us a little bit more about who you are, where you come from, and what red flag do you see in this case?
Yeah, thank you, Maria. I am Vale. I'm from Lima, Peru, and I also see a lot of lower back pain that usually is from muscular causes, and so the red flags are important. And in this case, they mentioned that leads to sleep difficulties. I mean, this can be, I guess, a little tricky because you see that the red flag of the pain that wakes you up at night for headaches, for example, is pretty clear. But when it comes to back pain, you cannot have a bad bed or something that makes your back hurt at night. So I would like to know more about the history, if this person has a good sleep hygiene or what type of sleep difficulties are they encountering, to see if this is a red flag or not.
Amazing. Thank you so much. So Veronika, do you want to give us a little bit more information?
Yes. So this lady is taking paracetamol and tramadol to relieve her pain. She says that many years ago, when she was a teenager, she fell down some stairs and could not walk for a number of weeks. She didn't go to the doctor at the time because it was too far away from her home, and it was left alone to slowly get better on its own. She feels that it's not been the same since then. She has not had any new falls, but has been unsteady on her legs. Her husband has been doing most of the physical work around the house and their farm. And on examination, there's no obvious tenderness of the spine. The left leg raise causes pain, and there's no loss of muscle strength or sensation in her legs. All right.
Thank you, Veronika. And I love how we're jumping into some rural problems right up from the start. Anybody who comes to a rural clinic, basically has had weeks and months, or maybe even months, of being treated at home and trying everything possible before they consult. Marce, in your experience, has this been the case? How much do your patients wait until they come to the clinic? Marce, do you want to share some of your point of view on how patients wait a couple of days and months to come to the clinic? Ooh, maybe Marcia's not.
Oh, sorry, Mary. Yeah, so I think it's for rural areas so important to know that the patients, since they are so far from medical care often, they wait so much time to look for the doctor until they don't have any other solution. So I remember that once I was in a rural region doing a clerkship, and we had this young patient that he was losing the vision of one eye. But then I was talking with him and I saw that he didn't have the vision of the other eye. So he only looked for healthcare when he was completely losing both eye visions. It was a trauma in the other eye, but he had the other eye, so it was fine so far. But then he suddenly developed losing the vision of both eyes. So it's important to consider, especially in this scenario, because they don't have a doctor for the past 5 months. So they probably were not seeking care at all. Yeah.
Thank you, Marcia, for sharing. I think that is just bread and butter in rural health, right? And so definitely that also brings up the level of concern. So whenever we see back pain that has passed for a couple of days, that doesn't concern us as much. But when it's back pain that hasn't resolved over the last couple of years even, that brings us a little bit more level of concern. Amir, you noticed something very interesting in this story, which is not about our patient at all, but about the husband. The husband presented hoarseness. I was wondering if you want to elaborate more on that thought and tell us more tell us more about who you are and where you come from as well.
Yeah, hi. First, I have to say it was Valeria's idea with Bot's disease. I was thinking about it with the fact that it's just curious how she mentioned. I know it's bias to focus on the presenter rather than on the case. Perhaps you know, if we were the ones doing the exam, we wouldn't really notice that. But just because it was mentioned that the husband has hoarseness, that I thought perhaps this could be some environmental or infectious agent such as TB. But I don't think TB typically causes things like hoarseness. I'm not so sure. Yeah.
Thank you so much, Amir. And I love how we're focusing on all members of the family. I think that is something that also is characteristic of rural health and community health. You don't really work with one patient, but you do work with all of his family and support group. And I think one of the questions that we ask the most when we're concerned about TB is not really focusing on the patient, but we tend to ask, does anybody at home have a chronic cough? Does anybody at home have cough with blood? And I think that you and what you've explained showcases this really well. So Veronika, do you want to give us a little bit more information?
Veronika, I think your mic is on mute.
Yes, thank you. So you have found that you have some results from a previous lumbar spine x-ray for this lady, which shows a possible old fracture at L5 with arthritic changes and scoliosis. You note that she is limping when walking, but otherwise is managing to walk with assistance from her husband. You give pain relief for sciatic pain, and you rush off to see your next patient. Over the next few months, the woman will visit with her husband about her back pain every few weeks. You note that the husband's voice is always hoarse and that he is coughing. He also seems to be losing a lot of weight. You do not think too much about this as your always full waiting room is calling and there are many patients to see. He is there to help his wife and never makes any appointments for himself.
Veronika, you're such a storyteller. I love it. And I love how you're also highlighting some aspects that, whether we like them or not, are the reality of a lot of primary care clinics. They're always oversaturated. We, especially, there's a big gap in doctors around the world and healthcare workers around the world, but that is exacerbated in rural areas. So the ratio between patient doctor is exaggerated in those areas. And that is the reality. And although it is sad, it's something that we have to work with. My students, when they come to the clinic with me, they're sometimes worried that some consults go over really fast. And I always tell them, you need to know which consults to dedicate time for. So some consults can be 10 to 15 minutes, but then you really need to, you do that because you're trying to set time for some consults that might take you a little longer, such as this one. Veronika, I wanted to ask you, how do you manage that exaggerated patient burden on an everyday basis without like losing hope and losing your sanity?
So it can be really difficult with a lot of anxiety after work is my best answer. So I try to remember that I can only do what I can do in the time I have. And if I focus too much on any one case, I am then leaving less time for other people that may have worse problems, needs that will need longer, and we all have the same amount of time in the day. So I, at the moment, focus on the problem they're presenting me with. I wish I could give more time. I think that's what I wanted to kind of focus on a little bit with this case. So this was a very big learning case for me, in kind of the rear view after it all happened. So I was very new. I had a lot of new things, lots of people to look after. I was trying to work out what to do in a limited resource setting. And I focused on the problem in front of me. And that's how I got through the sheer number of people seeing me. And later at night, you think about all the things you might have missed. Is kind of, I don't know if it answers your question, but that's the general feeling of practicing in rural areas that are understaffed and where the demand is high.
No, I love it. Thank you for sharing it. And I love the after quote of with a lot of anxiety, because that is how most of our days end. There's so many different types of decisions that we need to take that we don't really think about when we're at the hospital, right? When we're at the hospital, we tend to send a lot of work up, and it just shows up at our hands the next day, and we don't really need to worry about what cost that the patient or their family had, or we don't really worry about, um, you know, if we don't see it, somebody else is going to see it. When you're alone in a rural area, it feels very anxious, provoking at the end of the day. Marcia, do you want to share a comment as well on that note?
Yeah, and another thing that I noticed with rural doctors is that often they will be leaving the rural area, and you are going to be the doctor on call every day, like during the weekend, during the week, because if something happens, you are the doctor there. So you need to handle emergencies, deliveries, everything that happens there. So it can be very, very overwhelmed and burnouted.
Yeah, you're always on call, right? Yeah. And I'll transition to the med part really fast, but thank you like both of you for sharing those thoughts, because it's very, it feels very lonely, but everything in retrospective is clearer and everything in retrospective becomes easier. And that is also like the power of reflection at the end of the day, and the reflection of that happens also here during VMR. We had some interesting features of the case, both with the wife and the husband. I noticed Hans wanted to share something on the red flags of hoarseness and weight loss. Hans, do you want to open up your mic? Tell us a little bit more about who you are, where you're from, and what are your thoughts with the husband's concerns?
Yes, I think we have to put some attention to the husband as well. Hoarseness that does not improve. And now he even mentioned weight loss. And the weight loss somehow gives me a leery thinking. The first red flag is there a malignancy somewhere smoldering in close to the recurrent laryngeal. That could be a thyroid cancer, a lung cancer, or anything like this. So we really have to look at the husband. And then with the wife, I'm not sure we can perhaps think that it is something which has developed since her fall, where she injured her spine, but we shall see. There are surprises.
Tons of surprises. We're working two cases at once. Very classic of rural areas. Veronika, do you want to give us more information?
Yes. So 5 months later, the husband, 73, is in your waiting room without his wife. You struggle to understand him as he's lost his voice and is straining to whisper. He has come to see you as he is concerned about new firm lumps that have appeared on his neck. He has also been finding it difficult to swallow over the past month. This is the first time you've had a consultation with him as the patient. He has been a long-time smoker of over 30 years, and he also drinks alcohol daily. He has noticed that his pants have been becoming more loose and that he has had to tighten his belt more and more. Over the past few weeks, he has not really felt like eating, and he's felt more tired. On examination, you find 2 large firm lymph nodes on the right side of his neck. He is very thin, and you can see all of his ribs. On examination of his mouth, he has a few missing teeth, The throat looks red but is otherwise clear, and he has weak air entry on both sides of his chest, and there is no air entry at the lower left base. So I can stop here if you like, and then we can go to what happened after that.
Amazing. So what a plot twist. Things have changed very fast. Maybe in the chat you can write what you think the diagnosis is, but I don't know if Marcia and Veronica are going to agree with me, but whenever you're working in a rural area, you have two types of questions to answer. First is what's happening medically wise to the patient, and the other question is, what's happened in the life of the patient. And sometimes that question, you really need to focus on things that you never really learn about in medicine. So for example, what kind of things did the patient have to overcome to visit the doctor? Like, why did he wait so long? Why was he more concerned about his wife than himself? What types of struggles is he having on his personal life that prevented him from that allowed him to like overlook at some of these symptoms? And whenever you see somebody at a rural clinic, you know that they're overcoming a lot of things to be there. Maybe they're losing the salary of the day. Maybe they'd have to, you know, cover the costs of transportation. They have to figure out who are they going to leave their kids with. I think this case really, emulates that very well. So maybe we have like two types of hypotheses, right? The medical hypothesis and the one that is like, why did it take so long for him to come, and maybe what types of different things could have done before that would have made this patient consult sooner. And Yasmin, I know that you have some interesting thoughts on diagnosis and on why did he wait so long. So maybe you want to share your thoughts on both questions.
Hi, everyone. And I have been a little bit MIA on this amazing talk. After looking at this, I have this question, like these people in rural settings today, are they exposed not only to smoking, but also to coal stoves or any other type of smoke? Because I graduate from Mexico, and back there we also have to do at least 1 year of rural work. So I used to see a lot of COPD, lung issues, of course TB, but seeing this all this clinical picture, I will think bronchogenic carcinoma or a squamous carcinoma in the throat, as a lot of people have seen, have mentioned in the chat, especially because of this, the hoarseness, the weight loss, and cough. Also, I know that it is sometimes very difficult and frustrating because I don't know if they would have access to X-ray at least. I don't know. In my opinion, I would find a lot of cases where even if I wanted to do a follow-up to my patients, they won't be able to get X-ray, not even an X-ray, because the transportation was difficult, or they wouldn't even have the economic means to go. That's my first thing about the husband. And about our lady, I will think something more chronic and not so much malignancy, but something rheumatologic. Those are my thoughts.
Awesome. Thank you so much for sharing it, Yas. So Veronica, where did we end up with the case?
So after the examination, you urgently sent him to hospital with a suspected metastatic throat cancer. He is shocked, but follows your instructions. He goes home to pack a bag and has a friend take him to hospital 40 kilometers away because he doesn't have a car. The following week, his wife visits you and informed you that he was diagnosed with stage 4 metastatic throat cancer. He is still in hospital awaiting surgery and chemotherapy, and she has been told that the prognosis is not very good.
Wow, all the feelings. So Veronika, very sad case, and you mentioned earlier that was a very as that was a learning case for you. What things do you think after? I think you saw this patient a couple years ago, right?
A lot of years ago now.
So it's. I love how you brought a case from your past because it also allows you to see how much you've changed and you've grown. What things do you think you learned from this case?
So I think this was I would use this case to describe what my first kind of interaction with rural healthcare was. So I didn't know what to expect. I didn't have a lot of experience in primary healthcare on my own because that was the situation. So I had gone from hospital medicine, very supervised primary care situations with a mentor, to being alone in a village with my nurse. That was it. That was the team, me and my nurse. And my nurse had all the information about the people. I didn't know the people. I didn't understand what the dynamics were. I didn't understand the family backgrounds. I didn't understand what kind of conditions they lived in immediately. So that took me months to kind of start to get a understanding of that community, and at the same time cope with the sheer workload. So I was constantly exhausted. And when you're constantly exhausted, mistakes happen more and more, whether you want them to or not. We're not perfect and we're all going to make mistakes. And that's also part of what you need to carry as you go through your career. So this for me was a mistake. That's how I see it, that I should have, during those first visits, because there were many, where the husband was not the patient, so I didn't really focus on him, but I did remember later when he came back as a patient that I had noticed that I had noticed, but I didn't action that in any way. And maybe now I would be more proactive and say, could you come and see me? Because, you know, if the patient doesn't know that this is a sign of something bad, they won't make an appointment with you. And I think in rural areas, there is a lot lower health literacy level. And they also have a certain culture where they don't want to bother anyone. They will wait until it's an absolute emergency before they come and see you, and they'll be completely silent. I've had people sitting in a waiting room silently having their heart attack, not complaining, actively with chest pain, just sitting amongst the 20 or so other people. And it's a very different situation than when you're in hospital and you're in an emergency department and everyone is there because they think it's an emergency and the ambulance has brought them in and everyone's rushing around them. That's not how it happens in rural areas. They kind of make their way slowly with whatever form of transport, or they walk a long way, or they get on their bike to see you with their heart attack. And then they sit and wait their turn in the waiting room because you're the doctor and you're important and they don't want to bother you with their problem. That's probably nothing. And that was an eye-opener coming from a mainly urban training kind of situation. And I think this case shows that in a way, so that it's important to understand the rural context. It's important to understand your community. It's important to act on those hunches and instincts that you have and you develop as time goes on, and to proactively care for your rural community. So not as passive as it might be in an urban area, to be more proactive. And I think that's also something we're not necessarily taught in that way, but is very, very important. Yes, that's my comment.
Well, Veronika, all the feelings. I loved your reflection on it. I've recently, well, not that recent, but I've been working at a rural clinic for like the last 8 months, and that learning curve is something that is very, very steep and very emotional. You know, you go through a lot of mistakes that, you know, we might have previously not noticed working at a hospital setting. And you learn a lot on patient advocacy and, you know, your rural community, as you said. So I think working at a hospital for so many years had, you know, blinded me to a lot of the reality and like the struggles people overcome to visit a doctor. And as you said, so in an urban setting, we're more prone to, you know, maybe letting things go, and like if it's really serious, he's gonna come back, or, you know, maybe just like ordering a battery of tests and figuring out like if it's something serious, it's gonna be there. On a rural care setting, you don't have that luxury to, you know, overstep some of those things. But I really love your reflection, and you know, you added the maybe, so you maybe would have seen that you maybe, like, if it presents to you today, you maybe would have seen it. And I think that's a maybe that we're all here for. So we all show up at 8 a.m. PST in a Saturday morning because we are scared of making those mistakes, and we hope that through these conversations, you know, that maybe ends up saving a life. I think that it's a very strong maybe, because I think you've reflected it so much that I have no doubt that you have already intersected some of your patients this way, and you've done things differently based on this case. Dr. Singh, I've noticed that you have been really active on the chat, and I wanted to ask you two questions. The first one, you know, if I don't know if you can open up your mic, but if you can, you know, would you want to share some of your thoughts on how, of, you know, patients that you wouldn't want to miss? You know, what wouldn't we want to miss in a patient presenting with throat problems? What would be your thoughts, or how would you proceed with a patient with hoarseness for a very long time?
Can you hear me?
Yeah.
Oh, I had to move inside. There was some gardening work going on. Yeah, thank you, Veronika, for bringing this case. This is a case that's really remarkable, and especially about the comments about the rural setting. Things that I would worry about, definitely with cancer, would be on my radar screen, especially farming community. You deal with a lot of chemicals and pesticides and fertilizers, and then when you're working hard, excuse the background, there's some noise in the background. Smoking and drinking, I guess a lot of farmers to work hard. There's even, I know in India, some farmers were also using narcotics to really be able to work hard, so they're exposed to, and the health literacy isn't as good as, say, in the cities, where they don't know the ramifications of using all of these substances. So these things can be risk factors for certain diseases. But other things I would think about, I was going through my mind, amyloidosis, sarcoidosis, thyroid disorders, hypothyroidism can cause hoarseness. And there's other systemic diseases. The back pain was very interesting. Metastatic disease can also be a red flag, especially that nocturnal part of it also can be a red flag. But I think the chat highlighted a lot of great things. Promise, Valeria, everybody, Yasmin and Amir, everybody's contributing great pearls of what we should think about with a case like this. But I did have a question, Veronika, I think I just put in the chat. It's a very difficult situation to be in, but I also can imagine the inroads that you made with the community and the friendships. And I was out in a clinic in Hungary once, and the physician was paid with eggs and chickens and bread and things like that. Do you have a similar experience like that?
Yes, I do, immediately. That is part of the rural culture in Croatia. So it is very common to get eggs, honey, jams, homemade. Sometimes if they've been hunting, they will bring you slabs of meat as well. So they'll bake cakes, they are very appreciative to have someone looking after them. That is how they express that, I think. And they may not have a lot of money, but they do try and give back, and they do invite you to events that are happening in the village, and they invite you to their house for dinner, and you know, they invite you to take you fishing. So yeah, there's a lot of community spirit in rural areas. I think people are a lot more connected. I guess the flip side of that is that when you go to the local supermarket, people will try and talk to you about their health issue or what happened last week or things like this. So sometimes when you're overwhelmed, that can be a little bit difficult to manage. So that was also a new thing for me. So during the first few months when I was just overwhelmed with everything, I felt that aspect was also quite difficult. So I had the tendency to withdraw rather than engage further with the community because I didn't have the emotional energy left after the workday, and I needed that space, and I couldn't get it because I was living in the community and they all knew where I lived. And I lived with the fear that someone was going to knock on my door about something. I'm going to have to rush off somewhere. So there's that side as well. So you have the good sides, but then you also have somewhat negative. I guess you know you're isolated as well. So you're on your own as the professional. And I had a few episodes where I didn't feel very well myself. And all I was thinking is, well, who's going to help me? Because there are no doctors here except me. So there's things like that also have to be kind of considered when you're in a rural area.
I love it. Thank you, Veronica and Dr. Singh, because the first question we ask our guests at Global VMR is what types of cuisine do we want to try when we're with you? And I think with rural health, you know, it's whatever the patients give you. So I think that's very universal of being gifted food and supplies and things like that. And it's always very, you know, you come to appreciate it. Marce, I also know that you're very passionate about rural health. Do you want to share what makes you passionate about it? What do you like about it?
Yeah, sure. Thank you, Maria. So I think for me, especially because I was born in a rural area. So I was born in a village in Brazil. So I think I feel like part of this community, you know, like growing up, having people in your house, getting like food and going to others' house. So I think that was the first thing, especially because like my father is a farmer, so I know the struggles. And then I met Rural Seeds, and I am part of this Rural Seeds since 2018. And it made me reflect a lot about rural health. Even though I was born in a rural area, I had never stopped thinking like how much it affects our health in general, how much like your zip code. I think it's like the major determinant of health that we have, because depending on the place you live, you have like different, not even like different exposures, but like different access to health. And that's big, you know, like not even your country, but inside your country where you live. And I think this history also highlights the power of the community. Like the patient, he didn't have a car, so he needs a friend to take him to the appointment. And I think it's a key factor in rural areas that you empower your community so they can fight themselves for healthcare improvements in the area, for more doctors. For example, Veronika was saying, often you are the only doctor there. It can't be like that. You need someone to help you. You cannot feel isolated. And when we like in Rural Seeds, we hope to have the support, you know, even maybe online, so we can talk with each other, like in a rural cafe. We get together just to talk about concerns and problems in rural areas. So I think that's really, really powerful.
I love it, Marcia. I recently saw on Twitter something that I retweeted and I thought it was really funny. Social determinants of health, or as everybody outside of medicine knows it as reality. So you know, I love your reflection on it. Promise, I love your question. Do you want to open up your mic, tell us a little bit more about who you are, where you're from, and ask the question?
Hi everyone, my name is Promise. I am a third year medical student in the US, and I have always been really interested in global health and rural health because I grew up in Hong Kong and I've been to rural parts of China and I witnessed, that villager lifestyle. And I knew very early on that they didn't have any clinics there, and they have to like walk hours to get to like their closest clinic. And so for me, I think because I had those experience, I kind of understand what that was like, but I could also see that those research, like if I could have some resources, I could my class them because for our training, it is not a required rotation for us. So we are in the hospitals with, a lot of coordinated care. And it's kind of like we don't really have to think too much outside of the hospital and like graded to like the system and the community aspect of it. So I think those are something that I really wanted to share with my classmates, and hopefully that will help them to kind of see the bigger picture and how important it is to consider that too, because like it's not required for us to have that kind of training. But for you guys, like Yasmin was saying, like it was part of her required rotation, and so I feel like that's something that I wanted to share with my classmates. And definitely have to check out Stella's Twitter posts.
Ooh, I think Promise lost a little bit of her connection, but Marcia or Veronica, any insider's tips on how to get to know more about rural health as a student?
Yeah, so it's something that I'm really passionate about to talk about because in Brazil we have the same problem, even though we don't have we have a huge rural population. Often in medical schools we don't have a special training for rural health. We don't have a residency for rural health, so we don't have a specific pathway for a rural doctor. So, Promise, what I did when I was a medical student, I looked for a clerkship outside like my university to know more about rural areas. And I think it's very important to know the place first, know if you are going to have some guidance there, a good mentor, because we don't want you to have a bad rural experience at first. It can be very traumatizing. And in Rural Seeds, we are trying to create a new project. It's called Rural Advisor. It's like TripAdvisor, but we are trying to create a new website where we can connect doctors with like mentors, doctors that could receive students for clerkships. We started in Brazil because we have a Rural Seeds group in Brazil that started this project. We already have some doctors that are volunteering to get some students, so that's very exciting. And we hope to be able to expand that for like a worldwide thing where we can have students from other countries going to rural areas in another country. So maybe in the future we will have something. But if anyone here is interested in doing like a rural rotation, we can talk and I can see if I can find some doctors. We have amazing doctors from Rural Wonka, and they are connected with Rural Seeds that they can maybe receive some students.
Thank you. I would definitely love to look into that.
Thank you, Marcia. Veronica, any other ideas on how to connect with or learn more about rural health as a student?
Please join Rural Seeds. So I think as a student, it really depends on which part of the world you're in. So there are some areas like Canada and Australia that have, and Scotland as well, that have very well developed rural health training pathways. And I think one of the ways you can learn is if you search for those programs, you can find a lot of information on their websites about what their program looks like, and a lot of it is based on something that's called longitudinal clerkships or placements. So where you are actually placed with a rural doctor in a rural practice, and you then experience rural medicine in that context and in a rural community, and it's a kind of a fully immersive experience. And there's been a lot of research done on it, and it's been found to be one of the better ways to kind of bring medical students into rural practice and have them feel more comfortable than practicing in those rural areas when they graduate. Unfortunately, in a lot of parts of the world, including Croatia, where I trained and am from, so my experience was I had a 3-day notice and was sent to this village. So I was in the middle of my training program in a city, and then there was a doctor shortage there with the official employer that I was with. I got called into a meeting, and 3 days later, I was in a village I'd never been in before, with no previous rural experience, with no preparation, just day one start, patients are waiting. And as Marcella said, that is not the best way to have a rural experience, but I survived it and turned it into trying to make it better for other people, and showing that you can come back from, you know, having a bad experience. It doesn't necessarily put you off rural forever. It just makes you more aware of the importance of it being differently organized, and for the support to be there. And I think part of what Rural Seeds is trying to do, it's trying to in some way provide support for those areas, particularly where there is no primary care even that is well organized with a training program, and then also in rural areas. So trying to provide that support remotely, because that's something that we can do. It's relatively low cost. And I definitely encourage students that have an interest to kind of get in touch with Rural Seeds, join. You can find out about lots of different activities that we run throughout the year. And if you have any projects that you think would be good for rural areas, you can bring them to us and we can help you develop them. So yeah, that's my that's my pitch on what students can do.
I love it, and I love both. I've been a part of like the Rural Seeds list and things like that for the last couple of years, and their cafes are great. So let's go to like an ad right now because Marcia has some has some news.
Yeah, thank you, Maria. Let me see if I can share my screen. So I just want to share with you all and invite you all for this Rural Cafe, the next edition. It's going to be about a very special project that we recently found out. So we all know that we have a lot of technology to travel to space and maybe like start developing possibilities of living in another planet. We have a lot of research and resources about that. And you might be thinking, why I'm talking about that? Because in this Rural Cafe, we are going to discuss about the possibilities to use that technology that, for example, to live in Mars, to travel to the moon, for rural areas here in our planet. So maybe we could use resources to save water, to be possible to have fresh vegetables for the rural communities when they have a dry weather, or even provide electricity. So we have this professor that he has been having like a setting in Brazil for like experience in Brazil, like you were in Mars. I can share the link here, and we are going to discuss about using those resources for rural areas. Thank you, Maria.
I love it. You know, being a rural doctor means more than being just a doctor. It means, you know, doing everything from organizing medicine, trying to figure out how to get your patients water or electricity and things like that. So I love the idea for their new rural cafe. Hopefully I'll see some new faces there. And I know that we're running low on time. Veronika, I really want to thank you for coming here. We do a lot of these VMRs, and after 2 years, I think it's been the first one that's dedicated for rural health. Hopefully, it'll be the first one of many cases that you can bring to CP Solvers. We always, you know, we are focused on clinical reasoning, and I do believe that there's no place that demands that much clinical reasoning as being in a rural area. So thank you so much for opening up our eyes to a part of your world and a part of Marcia's world. we really thank you for it, and hopefully we'll see each other soon. So
Thank you all very much.
Thank you.
Thank you all, and please consider
Thank
enjoying
you.
the seeds.
Yeah. And thank you, Deborah, for also being here. So we'll see each other around for another Global VMR. Bye.